Okay, picture this. You've spent months getting ready, right? The anticipation, all the tiny clothes, planning the nursery.
Mm-hmm.
And then that incredible moment arrives. Your baby's finally here. And for a little while, maybe the first few days, it's just pure joy.
Absolutely, that overwhelming feeling.
Yeah, everything you sort of dreamed about.
But, for a lot of new parents, maybe even most, that initial high, it can start to feel a bit more complicated.
Right, it shifts.
It really does.
Hmm.
Sometimes subtly, sometimes quite quickly as the days turn into weeks.
Yeah, that rosy picture can change fast. Suddenly it feels like your whole world is just worry.
Constant worry.
Constant, yeah. These questions that just gnaw at you. Is the baby eating enough? Is this crying normal? Are they okay?
And it's not just thinking it, it's like it consumes you.
Totally. It gets in the way of the tiny bit of sleep you might be getting. You feel tense, maybe irritable. Your heart might race sometimes, or you have these moments of just sheer panic.
And then you start noticing other people are noticing you. Your family might gently ask, "Are you doing okay?" They can see you're maybe struggling a bit.
And it's so natural in the middle of all that chaos to ask yourself, is this just me? Is this normal?
Is this just what having a baby feels like?
Exactly. Is this level of anxiety, this feeling of being completely overwhelmed, is it supposed to be like this?
That question is just huge. And it's precisely where we want to focus today.
Yeah, we're doing a deep dive into postpartum mental health. We really want to help unpack the landscape, the differences, the overlaps.
Yeah.
What's actually going on with the baby blues versus
Yeah.
postpartum depression versus postpartum anxiety.
We're hoping to give you kind of a clear path through the information, cut through some of the noise and confusion.
Get to the core insights.
Exactly. What these experiences are, how they show up, and importantly, what they might mean for you or maybe someone you care about.
Okay, so let's start with the one everyone's heard of, the baby blues. It sounds almost expected, right?
It really is. I mean, the baby blues are incredibly common. We're talking a huge majority of new mothers experiencing them to some degree.
Okay.
You can think of it as a very normal physiological reaction happening right after birth. It's heavily tied to that massive hormonal shift.
The big drop in hormones.
Yeah, that dramatic fall in estrogen and progesterone levels plays a huge role.
So what does that actually feel like for someone? Is it just feeling a bit low?
It can be, but often it's more than that. People describe feeling sad, sure, but also suddenly tearful, like crying for no apparent reason, feeling really overwhelmed by everything. Mood swings that come out of nowhere, maybe some anxiety mixed in, irritability.
Trouble concentrating too.
Yes, reduced concentration, and sometimes temporary changes in appetite or sleep, even beyond the baby's schedule.
That already sounds like a lot to handle.
Yeah.
So what's the key thing that separates the blues from something more serious?
The absolute defining features are that the symptoms are mild and brief.
Mild and brief. Okay.
Right. They usually pop up a few days after delivery, and crucially, they fade away on their own within about a week, maybe 2 weeks at the absolute most. They don't fundamentally stop you from caring for your baby or yourself.
Got it. So that 2-week mark is kind of a guideline. If those feelings stick around longer or feel way more intense, that's a flag.
That's precisely the signal. If it persists beyond 2 weeks, or if the intensity feels debilitating rather than just blue, that's when we need to consider if something else is happening.
Which brings us to postpartum depression, or PPD. We hear this term a lot. How does it really differ? How does it step up from the blues?
Well, PPD can sometimes sneak up on you, maybe feeling like the blues initially. But you're right, it's a definite escalation. The intensity is much greater, and the duration is significantly longer.
Right.
This is where it really starts to interfere with day-to-day life. Caring for the baby feels overwhelming. Managing household stuff, even basic self-care can become incredibly difficult.
And it's not always immediate,
Yeah.
right? It doesn't always start right after birth.
That's a really important point. No. While it often develops in those first few postpartum weeks, PPD can actually start during pregnancy.
Oh, wow.
Or it can emerge anytime within that first year after the baby is born. That timeline surprises a lot of people.
A whole year.
Okay.
So let's dig into the symptoms. What does PPD look like, feel like, beyond just that sadness we talked about with the blues?
It's a much broader and deeper experience. Yes, there's often that persistent low mood or really severe mood swings, maybe crying excessively. But crucially, it often includes real difficulty bonding with the baby.
Feeling detached.
Feeling detached, yeah, or even withdrawing from your partner, your family, your friends. pulling away from support.
And the physical side sounds pretty significant, too.
Oh, absolutely. Big changes in appetite are common, either eating way less or way more than usual. Sleep gets seriously disrupted.
Beyond just the baby waking you up.
Yes, experiencing insomnia even when the baby is sleeping, or on the flip side, sleeping way too much. There's often this bone-deep fatigue, a total loss of energy, and losing interest or pleasure in things you used to really enjoy.
You know, the materials we looked at mentioned intense irritability and anger. That feels like something people don't always associate with depression.
It's a really key feature of PPD for many people, feeling constantly on edge, easily angered, quite restless. Alongside that often comes this profound fear of not being a good mother.
Oh, that must be awful.
It is. Deep feelings of hopelessness, worthlessness, shame, guilt, feeling totally inadequate. It can also cloud your thinking, making it hard to concentrate, make decisions, think clearly.
And this is also where anxiety starts creeping in, even within the PPD diagnosis.
Exactly. Severe anxiety and even panic attacks can be part of the picture for PPD. It really highlights how interconnected mood and anxiety often are in this period.
And then, the most severe and thankfully rarer symptoms.
Yes, we have to mention the possibility, the devastating possibility of having disturbing thoughts about harming yourself or harming the baby, or recurring thoughts about death or suicide.
Those are absolute red flags.
Immediate red flags. They require urgent help.
So, unlike the baby blues that just kind of fade, PPD, if it's not addressed, can go on for months and months.
That's the tough reality. Untreated PPD can linger for many months, sometimes even longer, and be truly debilitating.
Okay, let's shift gears a bit and talk about postpartum anxiety, PPA. It feels like PPD gets more airtime, but PPA sounds incredibly common too.
It really does. PPD is definitely better known, but estimates suggest PPA affects at least 1 in 5 new mothers.
1 in 5, that's huge.
It is. And it's really important to know that PPA can happen all on its own, totally separate from depression, or it can happen right alongside PPD. They can co-occur.
So how is it distinct? If PPD is mainly about that low mood, that sadness, what's the defining feature of PPA?
The absolute hallmark of PPA is excessive worry, fear, tension. These anxieties are usually intensely focused on the baby's health or safety, sometimes on the parent's own health, or just the overwhelming burden of the parenting role itself. So where PPD is more about sadness, disinterest, hopelessness, PPA is dominated by this feeling of constant nervousness, being on edge, a sense of impending doom almost.
Can you give some specific examples? What might PPA actually look like day to day?
Well, that excessive worry is number one. We're not just talking about normal new parent caution. This is persistent, overwhelming worry that you just can't shake.
Consuming thoughts.
Totally consuming. Another really distressing symptom is intrusive thoughts. These are unwanted, recurrent thoughts or images that just pop into your head. They're often really upsetting, maybe violent or disturbing, and very hard to control or dismiss.
That sounds terrifying.
Yeah.
Does PPA show up physically too? Anxiety often does.
Oh, for sure. PPA can definitely trigger physical symptoms, things like a racing heart, feeling short of breath, dizzy spells, nausea, even when there's no underlying medical cause.
And sleep, another casualty.
Yes, but often in a specific way with anxiety, it's the difficulty falling asleep or staying asleep because your mind is racing with worries. You're lying there, the baby's finally quiet, but you just can't shut off the anxious thoughts.
Irritability and restlessness pop up here as well, like with PPD.
They do. That feeling of being keyed up, on edge, easily snapped at, often without a clear reason. And another sign can be avoidance behaviors.
Like avoiding certain situations.
Exactly. Actively avoiding going places or doing certain things because of this deep-seated fear that something terrible might happen to the baby if you do.
What causes PPA? Is it just the stress of a new baby?
It's likely a mix of things. Those same abrupt hormonal drops we talked about with the blues, the estrogen and progesterone cliff dive seem to make people more sensitive to stress, which can definitely trigger anxiety.
Yeah.
Then you pile on the universal sleep deprivation, which wreaks havoc on your coping mechanisms, and add the sheer immense weight of responsibility for this tiny human. It's kind of a perfect storm for anxiety.
Does having anxiety before pregnancy make you more likely to get PPA?
Yes, absolutely. A history of anxiety, either before pregnancy or during, is a significant risk factor. A history of pregnancy loss can also increase the risk. And interestingly, some research suggests anxiety, along with sadness, can sometimes spike after weaning from breastfeeding, again pointing towards those hormonal fluctuations.
Right. So for someone listening right now, maybe feeling constantly worried,
Hmm.
how do they tell the difference between, just normal new parent jitters, which everyone has, and actual PPA that needs attention?
That's such a critical question, and honestly, it can be really hard to judge from the inside. The key things to consider are the intensity and the impact of the worry.
Intensity and impact.
Right. So it's one thing to check on your sleeping baby frequently. It's another thing entirely to stay awake all night, every night, paralyzed by the fear they might stop breathing, even when there's no reason to think that.
Or like being afraid to leave the baby.
Exactly. It's normal to feel a bit nervous leaving your baby for the first time, but it might be PPA if you feel so intensely scared that you literally can't leave the baby, even with a trusted partner or grandparent, because the worry is just that overwhelming and debilitating. It's that excessive, life-disrupting level of concern that really signals, okay, time to talk to someone.
Okay. And beyond these broader conditions like PPD and PPA, sometimes people experience more specific things like panic attacks or postpartum OCD.
That's right. Panic attacks can happen postpartum. These are sudden, intense surges of fear or discomfort. They come on really fast and peak quickly, often with really strong physical symptoms: heart pounding, sweating, trembling, shortness of breath, maybe chest pain, dizziness, and this terrifying feeling of losing control or impending doom.
Just awful. And postpartum OCD, how does that show up?
So this is obsessive-compulsive disorder presenting after childbirth. It involves obsessions. Those are the recurrent, persistent, unwanted, intrusive thoughts, images, or urges that cause a lot of distress. And often these obsessions lead to compulsions, which are repetitive behaviors or mental acts that the person feels driven to perform to try and neutralize the anxiety or prevent something bad from happening, like excessive checking, cleaning, or mental rituals.
You mentioned intrusive thoughts earlier, and sometimes these can involve thoughts of harming the baby, which must be incredibly scary for a parent.
Absolutely terrifying. It's one of the biggest fears that having the thought means they might act on it. But, and this is so crucial to understand, when these intrusive thoughts of harm are part of an anxiety disorder like PPA or OCD, the parent finds them deeply distressing, repugnant, and goes to great lengths to avoid them or ensure the baby's safety. They are extremely unlikely to act on these thoughts. The horror they feel about the thought is actually evidence that it's ego-dystonic, meaning it's against their values and desires.
That's a really important distinction.
It really is. These thoughts are symptoms of the illness, not indicators of intent.
Now, there's another condition, much rare but extremely serious, that we need to touch on: postpartum psychosis.
Yes. This is very different from PPD or PPA. It's considered a psychiatric emergency. It's rare, maybe affecting 1 or 2 births out of every 1,000, but it's critical to recognize because the consequences can be severe.
And it comes on quickly.
Typically very rapidly, often within the first week or 2 after delivery. The onset can be quite dramatic.
What are the warning signs people should know about?
The symptoms are severe and mark a break from reality. We're talking about things like significant confusion and disorientation, obsessive thoughts about the baby that might seem bizarre, hallucinations, seeing or hearing things that aren't there.
Delusions, too.
Yes, delusions holding strong beliefs that aren't based in reality, maybe paranoia, believing someone is trying to harm them or the baby. Also, severe sleep disturbances, sometimes periods of excessive energy and agitation, rapid mood swings, and tragically, there can be thoughts or actual attempts to harm oneself or the baby.
So if anyone sees these signs in a new parent or experiences them, immediate action is needed.
Absolutely immediate. Go straight to an emergency room or call emergency services. Postpartum psychosis requires urgent medical and psychiatric treatment. It's not something to wait on.
Okay. We've been talking a lot about mothers, understandably, given childbirth and the hormonal shifts, but it feels really important to say that postpartum mental health struggles aren't only experienced by mothers.
That is such a vital point to make. Thank you for bringing it up. Research is increasingly showing that new fathers or partners can also experience significant mental health challenges postpartum.
Maternal postpartum depression.
Exactly. Paternal postpartum depression is real. It's probably underdiagnosed and definitely underdiscussed, but it happens.
And do the symptoms look similar to what mothers experience?
Remarkably similar, actually. We see sadness, fatigue that goes beyond normal new parent tiredness, feeling overwhelmed, significant anxiety, changes in appetite or sleep patterns. It mirrors maternal PPD quite closely.
Are there specific things that might put a new dad or partner at higher risk?
Some identified risk factors include being younger, having a personal history of depression, experiencing relationship difficulties with the mother, or facing significant financial stress. The transition to parenthood is huge for everyone involved.
And the impact on the family is just as serious.
Absolutely. Depression in any parent can negatively affect the couple's relationship, the family dynamic, and potentially impact the child's development down the line. The emotional health of both parents matters immensely.
So the key message here is, if you're a partner, a dad, and you're experiencing these kinds of symptoms after the baby arrives, don't ignore it. Reach out for help too.
Please do. The good news is that the same kinds of support and treatments that help mothers therapy, sometimes medication support groups, can be just as effective for fathers and partners. Help is available for everyone.
Which brings us to seeking help. It can feel like such a huge hurdle, can't it? There's often so much shame or embarrassment, feeling like you should be handling it all.
That feeling is so common and so understandable. There's immense societal pressure and internal pressure to be overjoyed and coping perfectly. But admitting you're struggling isn't weakness, it's recognizing a health issue. It's actually a sign of strength.
So when should someone definitely make that call? Contact a healthcare provider, their GP, OBGYN, a therapist. What are the clear signals?
Okay, a few key things. First, remember that 2-week guideline for the baby blues? If symptoms like sadness, worry, fatigue, irritability don't start to fade after about 2 weeks postpartum.
Time to call.
Time to make the call. Also, if symptoms aren't just lingering but actually getting worse over time.
Okay.
Another big one is if the symptoms are making it genuinely hard for you to care for your baby. Like if feeding them, changing them, comforting them feels impossible because of how you're feeling.
Or just getting through the day.
Yeah, if symptoms are making it difficult to manage basic everyday tasks for yourself or the household. And then the absolute critical ones. Any thoughts of harming yourself or your baby?
Immediate help.
Immediate help. Or any symptoms that suggest postpartum psychosis, the confusion, hallucinations, delusions we talked about, that requires emergency intervention. Don't hesitate.
You mentioned earlier how symptoms can overlap, especially between PPD and PPA. Does getting the right diagnosis actually matter for treatment?
It really does. While there's overlap in treatments, getting an accurate diagnosis helps tailor the approach. For instance, cognitive behavioral therapy, CBT, is particularly effective for anxiety disorders like PPA or postpartum OCD.
Okay.
And while some antidepressants like SSRIs work well for both depression and anxiety, other treatments might be more specific. Knowing whether the primary issue is mood, anxiety, or both helps guide the most effective plan.
So talk therapy like CBT is a major part of treatment.
Often, yes. CBT is fantastic because it gives you practical tools to challenge those negative thought patterns and change behaviors that fuel anxiety or depression. Other therapies, like interpersonal therapy, IPT, can also be very helpful, especially for depression focusing on relationships and life changes.
And what about medications?
Medications can be extremely effective, especially for moderate to severe symptoms, and often work best in combination with therapy. SSRIs, selective serotonin reuptake inhibitors, are usually the first choice for both PPD and PPA.
How do they work?
They basically help increase the levels of serotonin, a neurotransmitter linked to mood in the brain. Sometimes, for very severe acute anxiety or panic, a doctor might prescribe a benzodiazepine for short-term rapid relief while waiting for the SSRI to start working fully, which can take a few weeks.
Okay. Now, the big question for many parents, especially mothers, taking medication while breastfeeding.
Yeah, that's a huge consideration and a very valid concern. It's something that requires a very careful conversation between the parent and their doctor.
Because the medication does pass into breast milk?
Yes. Pretty much all psychiatric medications are excreted into breast milk to some extent, though often in very small amounts. The decision is always about weighing risks and benefits.
Risks to the baby versus risks of untreated illness in the parent.
Exactly. How severe is the parent's illness? What are the potential risks of not treating it? What specific medication is being considered? At what dose? What do we know about its effects on infants? Factors specific to the baby, like their age, health, whether they were premature. It's a complex, individualized decision. But it is possible, and often very safe, to treat postpartum mental illness with medication while breastfeeding under medical guidance.
Good to know. So beyond the professional help like therapy and medication, are there practical things, maybe lifestyle adjustments that new parents can try to help specifically manage anxiety?
Yes, definitely. There are several strategies that can be really supportive and help lower that baseline anxiety level.
What's top of the list?
Something simple but powerful. Physical closeness with the baby.
Just cuddling.
Just cuddling. Holding your baby close, skin-to-skin contact if possible, actually stimulates the release of oxytocin.
Ah, the love hormone.
Exactly, the love and cuddle hormone. And oxytocin has a natural calming effect. It directly helps lower anxiety levels in both the parent and the baby. So lean into those snuggles.
Nice. What else? Sleep must be on there.
Oh, sleep is huge, though obviously incredibly challenging. The goal isn't necessarily more sleep overall, but trying to get at least one consolidated chunk. Aim for one uninterrupted 4-hour stretch if you possibly can.
How do you manage that?
This usually requires teamwork. Partners taking shifts, maybe even sleeping in separate rooms temporarily so one parent can get that solid block. It makes a world of difference for emotional regulation. And related to sleep, be mindful of caffeine intake, as too much can definitely amp up anxiety.
Makes sense. What about connecting with others? Does that help with anxiety specifically?
It really does. Spending time with other new mothers, whether it's friends, a formal support group, even online communities, can be incredibly validating.
Knowing you're not alone.
Exactly. Sharing your worries and hearing other people echo them, saying, oh my gosh, I worry about that too. It normalizes the experience, reduces that feeling of isolation, and can make the anxieties feel less powerful and less weird.
And physical activity always comes up for mental health. Still true postpartum.
Absolutely. Even when you're recovering and exhausted, finding ways to move your body is a potent anti-anxiety tool. It doesn't have to be intense. Gentle walks, stretching.
Yoga.
Yoga can be fantastic, especially types that incorporate mindful breathing. Those breathing exercises directly help calm the nervous system when you're feeling anxious or overwhelmed.
You mentioned weaning earlier in relation to hormones. Is there advice there?
Just that if and when someone decides to stop breastfeeding, trying to do it gradually rather than stopping abruptly, might be gentler on their system. The sudden hormonal shifts during rapid weaning can sometimes trigger mood or anxiety changes for some individuals. Gentle weaning allows the body more time to adjust.
Okay. And the final piece of advice, the one everyone gives but is maybe the hardest to take.
Ask for and accept help. Seriously. That saying, it takes a village, is not a cliche. It's a survival manual for new parents.
Let people help.
Let people help. Don't try to be a superhero. If someone offers to bring food, clean your bathroom, hold the baby while you shower, say yes. Delegate tasks. Maybe the mantra isn't sleep when the baby sleeps. Maybe it's fold laundry when someone else is holding the baby. Accepting support isn't failing, it's essential.
So, looking back over our conversation today, we've really tried to navigate the complex world of postpartum mental health. We've explored the differences and the overlaps between the very common temporary baby blues, the more serious and persistent postpartum depression, and that often underestimated postpartum anxiety.
And stressing that these aren't just mom issues. Fathers, partners, any new parent can experience these challenges.
Right. And the core message, I think, is that struggling after having a baby is not some kind of personal failing.
Not at all. It's a health issue, just like any other physical health issue that might arise during or after pregnancy. And crucially, effective help is available.
Reaching out, asking for that help, whether it's for you or encouraging someone you love to get help, that's a sign of incredible strength, not weakness.
Absolutely. And understanding these distinctions, knowing the signs, it's not just vital for the person going through it. It's vital for partners, family, friends, the whole support system. Knowing what to look for helps people offer real, meaningful support and know when to gently push towards professional help.
It kind of brings us to a final thought, maybe something for our listeners to chew on.
Yeah.
When you really think about everything that converges in the postpartum period, the massive hormonal shifts, the chronic sleep deprivation, the huge changes in identity and relationships, the sheer weight of this new responsibility. How does really understanding the potential for things like PPD and PPA challenge our broader cultural ideas? The narrative about what new parenthood is supposed to feel like versus the complex, sometimes really difficult reality that so many families actually live through.
That's a powerful question to end on. It really forces us to confront the gap between the idealized image and the lived experience, doesn't it? And maybe encourages a bit more grace for ourselves and for others.